You need
Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the learn one, do one, teach one approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration.
Good evening, everyone. Welcome to today's health access session. Frida, kindly confirm whether you can hear me.
Yeah, we can hear you, Glory.
Okay, so welcome to our today's session. And our topic for today is the previous sessions we've been tackling how we can use Actuate token to promote health access. And our previous lesson was the importance of Actuate token in individuals' health. So today we will explore now the importance of Actuate token in family health. So before we start the discussion, what is family health? Family health refers to the overall well-being of the members of the family, both the physical well-being, the emotional well-being, yeah, and the mental well-being. So we will explore the needs, the needs, the health needs of family, and how, and the challenges faced in getting these health needs, and how we can use our token to address this gap. Yeah, and so before we start the discussion, I will take you through the meeting agenda. We will start by the topic presentation by our topic master, who is Liliana Chieng. And then after that, we will have a privilege to hear from our CEO, who will give us additional notes and comments about the topic. And then we will have an interactive session where members can ask questions and views about the topic. And then we will have a summit announcement from Augustine Narokwe, and then we will adjourn the meeting. So I encourage active participation. Let's listen keenly, and yeah, let's contribute to the topic. So now allow me to welcome our topic master, Lilian. Lilian Achieng, can you hear me?
Yeah.
Okay, welcome.
Thank you. Good evening, everyone. I'm Lilian. I'm going to take you through today's topic, which is the importance of Actuate token in families' health. First, we'll define what's Actuate token. Actuate token is a utility token that powers the Actuate Health platform, which focuses on improving family health through personalized health coaching, nutrition planning, and fitness guidance. Then we'll define what's family health. Family health refers to the overall well-being of a family unit, encompassing the physical, mental, and emotional health of its members. It involves the ability of family members to function effectively and maintain positive relationships with one another. Then we look factors that contribute to family health. 1. Effective communication. Open and honest communication within the family is essential for resolving conflicts, understanding each other's needs, and fostering emotional intimacy. 2. Mutual respect. Family members should treat each other with respect, valuing each other's opinions, feelings, and boundaries. 3. Emotional support. Family members should provide emotional support to one another during difficult times, offering comfort, encouragement, and understanding. 4. Shared responsibilities. Family members should work together to manage household chores, childcare, and other responsibilities, promoting a sense of teamwork and cooperation. 5. Healthy relationship. Family members should maintain healthy relationship with one another, avoiding partner of conflict, blame, or resentment. 6. Access of resources. Family members should have access to resources such as healthcare, education, and financial support to promote their overall well-being. Lastly, strong family bonds. Family members should have a strong sense of connection and attachment to one another, fostering a sense of belonging and security. Then we look at the challenges faced in healthcare due to financial barriers. Financial barriers can pose significant challenges to healthcare system and individuals seeking medical care. One of the challenges is unaffordable healthcare cost. High healthcare expenses can make it difficult for individuals and families to necessary medical care. This can lead to delay of foregone care, which can have serious health consequences. 2. Limited access to healthcare services. Financial barriers can limit individuals' ability to access healthcare screenings and chronic diseases management. This can result in poorer health outcomes and increased healthcare costs in the long run. 3. Medical debt. Many individuals and families struggle with medical debt, which can have a significant impact on their financial well-being and overall health. Medical debt can lead to stress, anxiety, and other mental health issues, as well as hinder individual ability to access necessary medical care. Lastly, undeserved populations. Financial barriers can make it difficult for healthcare providers to serve undeserved populations, such as those living in rural or remote areas, individuals with limited English proficiency, and those with disability. This can result in gaps in healthcare access, and poorer health outcomes for the population. To summarize, addressing financial barriers to healthcare requires a multifaceted approach, including expanding access to affordable healthcare coverage, implementing cost-sharing programs, and investing in preventive care and public health initiatives. Then lastly, we look at how the application of Actuate token improve family health. The token can be used in several ways to enhance family health, such as access to premium content. Actuate token holders can access premium health coaching, nutrition plan, and fitness guidance content, which can help families make informed decisions about their health and well-being. 2. Discounts on health services. Actuate token can be used to receive discounts on various health services such as gym membership, nutrition consultation, and fitness classes, making it more affordable for families to prioritize their health. 3. Community support. Actuate token holders can connect with a community of like-minded individuals who are also focused on improving their health and well-being. This community support can be a powerful motivator and provide valuable insight and advice. 4. Gamification and rewards. Actuate token can be used to participate in gamified challenges and earn reward for achieving health milestones. This can help make the journey to better health more enjoyable and engaging for families. Then lastly, data tracking and insights. Actuate token holders can track their program progress and receive insight on their progress and receive insight on their health journey, allowing them to identify areas for improvement and make data-driven decisions about their health and well-being. To conclude, by leveraging the Actuate token, families can access a wide range of resources and services designed to help them improve their health and well-being. Thank you, and back to you, Glory.
Thank you, Lillian, for that presentation. Now, allow me to welcome Daktari to give further remarks about the topic.
Am I audible or am I not audible? Can you hear me, Glory?
Yes, Daktari, we can hear you. Welcome and go ahead.
All right. Wow, amazing. Thank you so much, Glory, for another session. Very, very powerful. And so, Lillian, thank you so much for bringing us back home, because family is our home. We all come from a family. Nobody does not come from a family, even if they think there's no family. That family is our origin. And as we all know, that charity begins at home. Who is charity? Charity begins at home. Charity begins at home. Can you believe it? Charity is another word for love. I think because some people could not say love, they decided to call it charity. Charity is equals to love. So charity and love is the same thing. Remember, the commandments, divine commandments, they are about love. Love the Lord your God with all your heart, with all your mind, with all your strength, and then love your neighbors as you love yourself. Now, for us as human beings, which are called the mankind, the biggest challenge we have in this world is exercising love or exercising charity. Exercising charity, which begins at home, like loving your family members so that they can do what? So they can love you back. Yeah, it is the law of divine harvests that if you love the people, they are going to love you back. That's why you're told, love others as you love yourself. But is that exercisable in families? No, we have a lot of conflicts, quarrels, things. Hatefulness, people hating brothers and sisters, brothers hating brothers, sisters hating sisters, brothers fighting with their fathers and sisters fighting with them. It's actually written in all those holy scriptures. Because that's called a family situation. It's kind of like a family field. Yes, siblings try to compete with one another, which is when it's not necessary. Imagine when siblings are competing with each other, and then there's a whole world to compete with. How are they ever going to win if they're fighting at home? Even spouses competing with one another, forgetting that the entire planet is competing against them. Yes, but matters get complicated when there's illness, when the disease shows up. Then family members begin blaming one another, or they blame. So if you get sick, some people say because because of your belief system, you don't believe enough, you don't believe in miracles, you don't pray enough, you don't do this. So it begins to happen like that. So people try to start looking down upon one another. And then some people become self-righteous in the family. Self-righteous means that they are so right and everybody else is wrong. So all these are family dynamics, which are not in just your family, they are in every family in the world. Can you believe it? Every single family, including the first family up there, where they think they call themselves first family as single. Well, let's say first family of Adam and Eve with their babies. You know what happened to them. So these are family dynamics and very complicated. So this family dynamic is really complicated by health outcomes in the family. Any disease that shows up just creates more suffering, more trials and tribulations. So trials and tribulations, and people hate each other even more. They're cursing one another because they're thinking that it is someone inside the family who is causing all this trouble. Yeah, there's nobody who is causing trouble. Diseases occur spontaneously. There are certain diseases that are not spontaneous. For example, if you drink too much alcohol and get too drunk and get knocked down when you're drunk, that is not a spontaneous event. That's the disease, the self-induced problem. Or if you go exercising promiscuity, then you get sexually transmitted disease. It don't happen accidentally. Yeah, unless somebody had taken away your mental judgment, and then you engage in lewd behavior that ended up gave you disease. But even then, when disease happens, whether it's from lewdness, like promiscuity or alcoholism, or it's from a spontaneous illness, like cancer just showing up out of the blue, or maybe other chronic illnesses like high blood sugar or stroke, heart attack, which have nothing to do with lewdness. They're just vicissitudes of life. So such thing causes so much strain in the family, stress. People start fighting one another because some people feel like so-and-so is not doing enough to support the sick ones. So some people, when they get sick, all they start to play the role of the sick. They take the sick role that they have to be taken care of by everybody else. And they will not let people stop learning how sick they are, you see. So it brings a lot of conflict. That's family. So there's so much conflict in families. But because they are not exercising charity to one another. So the first thing, there has to be charity, whether you have money or not. There has to be charity, that love for one another, because against charity, there's no law. Remember, that's what Paul said. Paul said faith, charity, and what? And I think faith, charity, and forgiveness, or something like that. Against such things, there's no law. Meaning that those are the only things that make the family survive. But there's something else which creates financial barriers. That is access to finance, which is nothing to do with the family, but something to do with the politics of the nation, the banking system. A lot of people become excluded from finance and they become unbanked or extra legal. And so they cannot afford to pay medical bills. And when disease comes, they get scared to go to hospital. So because the disease is not going to stop because you're scared. If you're scared, you are scared, but the disease is not scared of you. You're being scared. But the disease is going to continue ravaging the people in the family, even if they are scared of going to hospital to get checked because they don't have money. Now, Actuate token solve that problem of getting scared that you don't have money, because it's on the blockchain in decentralized finance. So Actuate token helps to solve that. At least we can now overcome the financial barrier. Although the financial barrier is not going to overcome the problem of absence of charity within the family. But when there's charity within the family, that's when there's love for one another in the family, that is what's called the spiritual health. So Lillian told us we need mental health, physical health, but then we also need spiritual health, which means having charity of love for one another, for families. That's a very big commandment. Love one another, and a lot of things happen. So first of all, we need to exercise charity, loving for one another, and then we can gain access to all the blessings that come with Actuate token, right? So you cannot receive blessings if you don't love one another, by the way. See, it becomes an adventure in missing the points, an abomination that causes desolation. Because going into new economy without charity, you become an uncharitable person or uncharitable family, where you have seen very, very wealthy families, very wealthy people, but their families are collapsing inside, they are rotting. So no, it's not because of money that families break down, or because of absence of money. It's because of absence of charity. So charity is very, very important. That is the one that solves all problems. But then, if charity, even if there's charity for love for one another, without the ability to pay, you still have a very huge financial barrier. But the good thing is that if you love one another, then becomes very easy to go to the next step. So you could say that Actuate token is an emblematic representation of charity. So charity comes in a way that it becomes tokenized. We're talking about tokenizing charity itself. So I hope you're following, you're tracking tokenizing charity, where people receive Actuate tokens, and MCF say that it helps to dissolve the financial barriers or flatten them. Barriers go away. And this is what we're going to continue working on, particularly after the summit. We're going to work very, very hard on this so that we can understand really how the token itself will tokenize charity or emblematically represent charity itself. What Lillian has told us, the way forward in this is giving people access to premium content. Content is what people like. Content means information about what to do, about the problems that you're facing. Nutritional information. Let me tell you what stunned me, because I got really stunned or surprised thoroughly, is that when I was in medical school, we used to read about nutrition, malnutrition in places. And some of the places that have got very high malnutrition rates I thought that I didn't know their geographical situation. I had no idea. Let me tell you that. Places like Kakamega and that belt in the East Coast, there's a rainforest, Kakamega rainforest. When I was reading medical literature about malnutrition, is that place has got a lot of malnutrition. Yeah. So the kind of malnutrition you'd find in a place that is a desert without water. Can you believe that? And I thought, because we were not learning geography in medical school, you just shown the distribution of malnutrition in the continent or in the planet. And the same thing, you have distribution of malnutrition even in the Niger Delta. People are highly malnourished. It's unbelievable that you can find people who are highly malnourished in a place that is a rainforest. It rains every single afternoon. And when it rains every single afternoon, it means that nature, or let's say, nature has provided sufficient food, even for the water, the crops they're growing there. But why are people not eating those things that are growing there? To create, eventually they get protein or absence of some essential nutrients, like certain proteins, amino acids are missing their bloodstream. Also, you have babies coming up with certain deficiencies, nutritional deficiencies. Even pregnant women get nutritional deficiencies in places where there is enough food provided by nature itself, not by action of any man or woman, but because the rain is raining every single day, the place is wet enough, so there's enough foliage, there's enough grains, there's enough stuff growing there, but people do not get it. I don't know. Yeah. So what happens in such situation? What's called lack of information. People do not know what to eat. Yeah. So they probably have grown away eating one type of food, and that food is lacking certain nutrients or elements, but nobody is telling them that some of those crops you can just harvest there, you're going to eat, and they're going to keep you healthy, get a balanced diet. So information, that's good premium information about balanced diet. How can you get it if you don't have access to information? So Actuate Token was going to do is bring us access to information, premium information, coming down from our institution of higher learning, because people in universities and colleges and research organizations, they have all this information with them. So if you were to go to a place like Jomo Kenyatta University of Agriculture and Technology, or even you were to go to places like Egerton, and even all these universities, they have departments of food and nutrition. They do something called nutrition science. And they know the kind of food that is highly balanced and the food that can grow in your local area. But that knowledge stays in the university. As if the university needs to eat. The university doesn't care. But the knowledge is for the people out there. But why is that knowledge staying in the university instead of getting out and going to meet the families who need it most to understand what to eat so they can stay healthy? So that the children stop getting reported as malnourished in the midst of abundance. Children are reported as malnourished in the midst of, they're not just reported, they are found to have, say, protein, calorie, and malnutrition. They have essential elements deficiency. And when you have essential elements deficiency, what happens? Any virus, bacteria, or any parasite will attack you because you have no defense. So that's what Actuate Token is going to do, help us get that knowledge out of the universities and deliver it to the people, and people can have access to premium content information. So members of the Actuate Nation, so they'll be having access to that. And we're going to, Actuate now is the pathway or the pathway or the channel through which information will flow out of the universities or institution of higher learning into communities. You see, so that these institutions stop maintaining their status as ivory towers. You have heard the institution of higher learning being called ivory towers. What's an ivory tower? An ivory tower is somewhere people sit there talking about their esoteric language. And when they're talking about the esoteric stuff, meaning that they speak their own language, which is incomprehensible to people in the villages where they came from. And that knowledge is sitting there in the ivory towers because it has no superhighway to take it to the village. That superhighway, like Baker superhighway, if there's no channel for knowledge to travel from the ivory tower into the communities, like if you had the city of Nairobi without Thika superhighway connecting the Nairobi to Thika and the interior of the country, the central province, then the people of the central province would be staying without knowing what is going on in Nairobi. And that's exactly the same thing that's happening to people in the communities because they do not have access to premium knowledge. So you want to put there an exclamation mark. Actuate is the channel through which premium knowledge will go to the communities so that families can feast upon it, feast upon the premium knowledge. That way they can create good dishes, recipes. They can create nice recipes that have got balanced diet with the material of foods that are available locally. I can attest to you that Kakamega is not lacking food available locally, but people are not eating it because nobody is telling them that that food or what value that food has got for their own bodies. A lot of people don't eat it. They don't know. So that's what. And then, of course, the other places, Kakamega is not just one place. It's just one place. There are so many other places. Even I told you Niger Delta, I did visit there. Niger Delta is highly endowed with natural resources, food everywhere, growing naturally. But you still fight malnutrition. How is it even possible? It's like incomprehensible. Like, what in the world is this? So, because people don't have access to information. In so many other places, spots, you're going to find some pockets of malnutrition among abundance of food. And then if you come now to the cities, when people are living in the cities, there's so much that you can do to create balanced diet for your family. But how do you do it without knowledge? Again, see simple things like what people are calling esoteric terms. In the university, they call them aquaponics. This is the technology for growing food right outside your window. Yeah. And it's not complicated, but the word sounds very, very exotic. So it's like they say all this type of information, we want to get it out, dish it out, let it out, get it out to the people so they can enjoy. So the other way that Actuate token would help families a lot is what Lillian has called discounts. When you're a member of the Actuate family, whatever you buy, you get discount because it can actually get captured on the blockchain, and so you are a member. You're one of us. You're in, so you get discounts of all the things that you can, and that gives you access to a lot of food and other services like health services. Even gym membership. Let's talk about services that maintain wellness, and so we can give incentives to people to practice healthy behavior. So you get discounts for, say, if you say, because right today we have the tracking system that if you exercise, even your phone itself, if you walk for a certain number of steps every day, your phone will be counting, and then you can get accredited that so that you can receive tokens for what you're doing. And we're going to be working on that. So those type of discounts, we are going to build them into the system. That's now for the people living in urban places, because urban centers, they tend to make people sedentary. So to incentivize people to get into active lifestyle, then it's going to be very interesting work happening also next year when we are building that into the discount, such that you can receive the tokens for getting active. Yes, and of course, just like the other point that Lilian talked about, community building, like when people are together, because you're a member, you are identified by the token, that you can get a service. Now, if there's a provider in your area who is who accept Actuate token, now you form a certain community and you're working together. So that way, people get a sense of belonging. You see that? So when they're working together, so family members, you know where you can send people, so you can even get things in credit. And then besides that, what we have always been talking about, health risk pools, which to pay for your health services when you eventually get sick. After all these preventive things do not work, you get sick, you go to a hospital, then the health risk pool, is going to pay for your services. So these are the things that we have in the pipeline, and we're going to be unpacking them one by one over the 2025. And of course, we want to make sure that this token is in the hands of thousands upon thousands of people for it to work. As we have explained before, for this to work, see, like even the health risk pool to work, we have to mobilize people in hundreds of thousands, so that we make sure that so many people are transacting, thousands of people are transacting the Actuate every day, and it is from the transaction that you collect the fees that is going to go into the health risk pool. So the great work is ahead, but most of the work right now, most of the work is being done, but there's a lot of work ahead, whereby when you participate and you're in, you will be able to receive services without having to pay a cent, because everyone who is here must participate in mobilizing people to get into Actuate, so they can all those people can have the tokens. First of all, they receive tokens, and then they can transact tokens. That means sending tokens from here to there. That collects a small fee, and that fee will be put in a liquidity pool. That liquidity pool is called a health risk pool. The health risk pool is like health insurance. Okay, so that is going to require us again to mobilize hundreds and hundreds upon hundreds of people to get them. So I think you're asking, what can I do to mobilize so many people? You can do that because just creating awareness, going to require intensive community education. So every day you want to make it your duty every day to tell people about Actuate token, whether your friends, your enemies, your family members, your relatives. I say your enemies because even if your enemy sends a transaction, that's going to account for your health risk pool. So there's no enemy in this type of things. That there's no enemy in spirit. That's why it's said, love your enemy even as you love yourself, because it is your enemy who is going to help you gain access to health services. So mobilize as many people as you can. Yes, and even those you can't, mobilize them and tell them to join Actuate, because when this thing gets on the ground now in terms of health, it's going to be very, very beautiful. So then you can see there are things, even the summit we are doing in December, is for this specific purpose, so that we can send this message to as many people as possible. And the summit we have in Boston next year. So we are moving ahead. We are not relenting, so that we can make sure this message gets into the ears of everyone. Those who can hear, they hear. But then hearing is not enough. They have to hear and take action, because hearing without action is what? Is dead. All right. So thank you so much, Glory and Lillian. A very beautiful presentation. And I believe that we have all understood that we take care of Actuate, and then the Actuate is going to take care of us. But before we can even take care of Actuate, we have to exercise something called charity. Love one another. Love people in your family. Because without love, all this we are talking about is pointless. Because charity begins at home. That's why charity begins. Charity begins at home. There is nowhere to go without charity, by the way. You better know that. That's a divine command. So love people in your family. Love your brothers, your sisters, your spouse, your aunties, and love them just the way they are. Okay? Love them just the way they are, no matter what they do. Because it's not up to you to whip them. Yes, but it is your love that's going to put them in the right path, the one you think they are not on. So that's it. So it's all about love, and that's charity. Charity begins at home, and let's get started with charity. So thank you so much, Glory. Back to you.
Thank you so much, Daktari. Wow, we have really learned. I think it's a virtue. Thank you for emphasizing on. I think family. I believe family love among family members is interesting and healthy, and that's where the health now begins, when the environment around home is safe, when you feel at home. Yeah, it's the best feeling. And thank you also for highlighting how we are going to utilize our very precious token, the ACT token, to ensure now the overall health of the family, to address the needs of the family and the existing gap in family healthcare delivery. Thank you. It's such a wonderful lesson to learn, and thank you to our topic master Lillian. So now I will welcome any question or any concern about this amazing topic. You can raise your hand to speak, or you can chat on the chat box. Yes. Any question, any concern, any comment, any view about the topic? Yeah, you're welcome.
Akasema akanimute.
All right, so we can go to the next. I think there's no questions. I think, what do you want us to do, Glory?
Okay, I will give a brief announcement about the summit. Yes.
Okay.
So this year, December, from 3rd to 6th of December, we have an upcoming summit with the theme, it is Actuate Pre-Boston Nairobi Summit, and the theme is using AI, blockchain, and DeFi to improve health and human development. So this conference aims to gather stakeholders from different sectors, stakeholders from health sector, healthcare organizations, the IT, blockchain, and DeFi to explore how these emerging technologies can be used to improve healthcare and health and human development. So we already have a good number of speakers. The speakers list is already full. We have over 100 speakers from some are medics from different specialties, all specialties of medicine. That is, may it be oncology, gynecology, all those. We have all the specialists and also specialists in IT, blockchain. We also have poster presenters. We still have a chance for you if you have an innovative idea, an innovation, like you have your project which you believe is aligning with our theme. You can apply as a poster presenter, and we encourage students to we encourage students to apply for these positions. It is a golden opportunity to network and to interact with experts in the field and to showcase what you can do. Who knows, maybe that's where that's where you will get your destiny. Yeah, so we also have sponsorship challenge where we are looking for sponsors. So and for any sponsor you bring, the package that sponsor offers, you get 5% of that, of what the sponsor offers. And sponsors, you can get sponsors who are from pharmaceutical companies, food companies, local companies, IT companies. Who is this? Okay. So yeah, you can get, we are also looking for exhibitors. Exhibitors are paying $1,000. Exhibitors, you can contact organizations like private hospitals and those specialists on private practice. Yeah, yes, and many others. So we encourage everyone to participate. The summit is for everyone. Let's leave no one behind. Let's move together. Yes, that's what I can say, Daktari. And we keep talking about the summit every day. So I think by now, everyone has a clear understanding of what to expect. And we also have the registration form, as you've seen being posted on our social media. The registration form for attendees is also, the registration is ongoing. We are charging $150 USD. So you can click on our website also to check about the same and register. And I welcome you all. Yes. Daktari, do you have anything to add?
Yes. Am I audible now? You can hear me? Yes, no?
Yes, yes, we can hear you.
All right, yes. So the summit, very, very beautiful event coming down. Yeah, coming down like the New Jerusalem. I keep saying New Jerusalem because it's written in Revelation 21. It's revealing itself. So the summit is revealing itself day by day. It's coming down like a bride. Okay, it's like a bride. So listen, very important things you've learned today about the family and Actuate token. Now that you can come to present to the people. That's why we do these things every day, so that you can have material or substance for you to present. So if you don't show up in the summit to make with a big poster showing people, you know that you have nobody to blame. You are the cutting edge. The cutting edge meaning the very front line of knowledge. And that is what is going to propel your career to the next level. Now, let me tell you something, a secret, if you did not know this already. You can never propel your career by not presenting it to other people. You have to present your work to other people so they know you. As it is written, nobody lights a candle and hides it under a bushel. Right? Nobody does that. If you put up a lamp, you put it on the table for everybody to see, to get light. That is the idea. Now, when you're here today, or in all the other Learn to Earn sessions, you are igniting your candle, you're setting your candle, you're setting light on your candle. So don't set your candle, you don't light it and then you cover it with a basket, with a veneer. You don't do that, because nobody lights a candle and then hides it in the bushel. The job of the candle is to be put on the table so that it can illuminate the entire room. So the room has got enough light. Okay, so today you have gained a lot of light in terms of what Actuate itself will do to family health. But of course, beginning with charity. So make a poster if you have not made one yet from all these conversations we had before. Even you can add to your posters that you've made before, but make a poster. This poster presentation is about what Actuate's going to do in human health. And with all those points we're talking about, like information access, discounts, community building, and health risk pooling, and all those things. And those things, if you now create your own arguments, you can do your own research out there, see how those things are going to work. That poster, bring it to the summit. Now you've heard it say that you pay $150. That is if you don't make a poster. If you come empty-handed, you have to actually pay, man, because there's nobody who comes empty-handed, because it is also written, there's no free lunch. Okay, so you can make a poster. Your poster is worth $150. So that will give you admission into the summit without having to pay $150. That's a very huge bargain for you, unless you don't like bargain, then you want to pay $150. $150, about 20,000 shillings. Which one do you want? To pay 20,000 shillings, or you want to pay 20,000 shillings in form of a poster? Yeah. So these are the things, and these are posters you are going to make spontaneously. So we have to continue encouraging you to let you know, which you already know, that the future you want to create is already in your hands. Yes, the future you want to create is already at hand. Things that you want, you don't have to put out any money to buy things that you already have. Okay, you do not have to purchase things you already have. What you have is skills, and then people get paid for those kind of skills. But who is going to pay you for your skills if you don't show people what skills you have? See that kind of contradiction? It is written that give and it shall get back to you. For those who give, they receive. See that? What you're giving is your sweat and time to create a poster, and all of it is given back to you. Because whatsoever measures you meet, they are met against you, and they're put on your bosom. They're fully loaded, shaken together, and running over. You know, they're compressed, shaken together, running over. That is what we are talking about. Give yourself out to make that poster. Particularly, Lina and Shane, now I know that you make a very beautiful poster on all these matters, because you have come to me, across to me is a very intelligent lady, and you want us to make that intelligence shine on the world stage. All right. So, well, that's all I would like to say, and thank you so much, everyone. But everyone, make a poster. I think Mr. Elijah has got a question. Mr. Elijah, do you have a question? All right. So, well, that's what I can add about that. So your participation is important. Just like you're participating here, participate in December, so that not just a few people get to know you, but you get to be known by a lot of people. See, yes, it's because, as we have said before, if you show up, then you receive a lot of support from a lot of people. Because again, it's written, for those who have, even more is given to them, and they have abundance. But those who do not have, that means you do not make a poster, even what you think you have will be taken away from you and will have nothing. See that? These are important lessons you want to learn in your life. For you to have, you must have. So for those who have, even that what they have, they're given more and they have abundance. You see? But for those who do not have, that means that if you think you do not have, if you don't have it to create a poster, even that poster you think you have will be taken away from you and will have nothing. So again, these things were written a long time ago, but they apply to us today. That's why I would like to encourage you. Be one of those who have, because you already have it. Having is not something that's going to come from outside you. Having is already there. It's already present in you. All you have to appreciate it, recognize it, and actuate it, make it come alive. Yes, that's what's called actuating, come alive. Because when you make it come alive, it comes alive in a very big way, and then you have abundance. So that's what I would like to add about that. And thank you so much, Gloria. I think it's always appreciate all of you guys for coming as we learn together. But I can tell you, do not be one of them who says, I was there among them, but now you are left behind. Do not be left behind. Okay. Now on our website, that is www.actuate.bio, you will find the Nairobi Summit, and you can go to the place for submit a poster and submit a poster. And don't procrastinate. Like say you will do it another day. That day never comes. The only day you have is now. Okay. The future is not here. The future is where you are living right now. You're creating the future as you go. So if you're thinking that you're gonna be doing something the next day or the next hour, now you're misguided. That's called the power of now. Just do it right away, right now, because when you do it, it is done. Then you can go to other things. But don't wait and say, oh, December is too far. And you will find that December will come and pass you. Again, so you don't want to be one of those who procrastinates, because procrastination is the thief of the only thing that you have in abundance, and the only thing that gets finished is called time. That is due to procrastination. Never ever procrastinate in your life. Every day you make sure that that day counts by doing something important, significant. If you find yourself saying, I'll do it tomorrow, then you say you're very misguided, because tomorrow is not here. Tomorrow is made by the things that you do today. Okay, you cannot do them tomorrow because tomorrow will have its own things for you to do. That's why you're told that don't worry about tomorrow because tomorrow has got its own things. Those own things of tomorrow are the things that you do today, and then they show up tomorrow. Have you ever thought about that? Whatever happens to you tomorrow is what you are doing today. Okay? Okay? Okay. So even whatever happens to you tomorrow is the things you do not do today that you ought to have done today. And because you do not do it, they are going to show up tomorrow, but those things, they show up on the negative side. So the upside and the downside of life comprises two things. The upside is the things you think you should do tomorrow, and then you do them today. They manifest tomorrow as the upside. The downside of life is things you think you should do tomorrow. You're supposed to do them today, but then you're saying you're going to do them tomorrow. Then they show up tomorrow undone, and then they bite you. And that's what is called hell. Or, that's hell is when those things show up and say, whoa, what happened? What happened is that you did not do what you're supposed to do. So these are some certain basic principles of life that will help you cope with all these things that looks like so many things to do. Things are not made to do. It's just do what you must do today, and then you find that things are not so many. Because tomorrow, when tomorrow comes, those things you did yesterday, they don't require attention anymore. They're already done. So this is what I'm talking about the poster. If you say you want to come and present the poster, don't push it for another day to make that poster. Sit down, make the poster, get finished, over, next. See? And that way, then you say, what's next? And that's how you keep building step by step by step. All right. So I hope you have all understood that. And I would like all of you guys to create these principles are very, very important in case some people want to, because you may not take them seriously. I just want to remind you that the seriousness of this issue, because they affect your whole life, not just when you're in Actuate Nation, even at home, at work, at school, in all the situations, even the community, even your professional life. Never, ever, ever procrastinate. If you see yourself procrastinating, first of all, kick yourself and say, why are you procrastinating? Yeah, ask yourself that question. Yes, never procrastinate. It's a rule, and you make it a rule of your own house. I mean, your own house is your consciousness. Never allow your consciousness or your mind to tell you to procrastinate. Now that is the prince of the air, the prince of darkness, who tells you to procrastinate. So you always tell him, keep quiet, get out of here. I am doing this right now. Right now. That's what you do. Make your poster right now. Do not push it to another day. Because if you don't do it, all this work we're doing, for you, it won't amount to anything, but to others will amount to a lot of things. All right. So think that's enough. Glory, back to you. And I think bye-bye, everyone, and thank you so much.
Thank you, Daktari, for making time for us. Thank you for once again. Thank you to our topic master, Lillian, and thank you everyone for attending. I would encourage everyone to make use of the knowledge that you acquire in these sessions. And let's meet. I have shared the attendance form in the chat box. Make sure you fill so that you can receive the tokens. We incentivize learning. That's why it's called Learn to Earn program. So let's meet again on Thursday, a time like now from 8 to 9. Once you fill the form, you're free to leave. Bye.